Good afternoon, everyone. On behalf of Vayah Vikas, I warmly welcome you to today's webinar on immunity and vaccinations in elder adults. We are delighted to see so many of you joining us as we continue our shared mission to support and empower senior citizens with knowledge that promotes health, independence, and dignity. We extend our sincere thanks to Bridge Health for collaborating with us in this important initiative. It is through such partnerships we are able to bring expert, relevant, and timely information to the senior community and those who care for them. Today's topic, immunity and vaccinations in older adults, is especially critical. As we age, our immune system naturally weakens, making us more vulnerable to infections and complications. Understanding the right vaccinations and steps to maintain immune health can significantly improve quality of life in later years. It is our privilege to introduce today's speaker, Dr. Jyoti M, physician, Bridge Health. Dr. Jyoti is highly experienced clinician with over 12 years of practice, both in India and internationally. A graduate of one of Kerala's leading government medical colleges. She has been based in Bangalore for past 3 years. Her areas of expertise lies in internal medicine and pulmonology, and she has worked extensively in geriatric and rehabilitative care at reputed institutions. Dr. Jyoti is known not only for her medical acumen but also for her empathetic and culturally sensitive approach to care, qualities that resonate deeply with our values at Vayah Vikas. We are confident that today's session will be both informative and empowering. Thank you once again for being here with us. Let's begin. Over to you, Dr. Jyoti.
Thank you, Ashwini, and a very good afternoon to all of you. So I'm Dr. Jyoti Madhuri on behalf of Bridge Health. Today I'll be delivering a talk on immunization in elderly population. Please allow me a moment. I'm visible to all of you.
Yes.
Yeah. So this talk is regarding immunity and vaccines. So there are two things, one immunity and the other is vaccines. So I want all of you to understand initially, before talking about the vaccine, what immunity is all about. So what is immunity? So immunity is the body's first biological defense mechanism. So whenever you come in contact with a foreign body, whether it be an infection from a virus, or whether it be a bacterial infection, or whether it be an environmental factors like a dust or a pollen, or whether it be a food that is you are allergic to, anything that the body comes in contact with an outside source, it is a defense mechanism that body first evokes is what is known as immunity. So the body mediates immunity through a range of cells, which are commonly called as WBCs or the white blood cells. So our body has got different kinds of white blood cells. You can see in this picture, neutrophils, lymphocytes, basophils, eosinophils, macrophages. So all these are different kinds of white blood cells in our body, which is a part of the immune mechanism. So just briefly, I'll tell you what the function of these cells are. So it is the neutrophil that will identify the foreign agent. The foreign agent like a virus, a bacteria, or a dust particle, or any kind of an allergen. Lymphocytes, which evokes the immunity in the form of cell-mediated immunity and humoral immunity. I'll not go into the details. And then basophils, which are predominantly involved in types of allergic reactions like asthma. Eosinophils, again, you will be very familiar with this term, again, for important in allergy and certain parasitic infections. Monocytes, which are scavengers or which basically, engulf the foreign bodies and help to clear them out of the system. So these are the 5 major types of cells that play a pivotal role in mediating the immune mechanism or the defense mechanism in our body. Now, we have 2 types of immunity. One is innate immunity. As the name suggests, it is innate, which means it is a type of immunity or defense the system with which you are born or which is within you. So it can be physical barriers like skin and mucosal membrane, hair. It can be chemicals like lysozymes in tears and amylase in saliva, which can kill the foreign bodies. It can be cellular defense, as like I have explained before, the WBCs, which are in your blood and its components, which help in providing immunity. Now, the second type of immunity is adaptive immunity. Again, as the name says, it's the immunity that we develop or we adapt after birth or during our lifetime. This can be, again, natural or it can be artificial. So, natural immunity is one that we develop naturally when we are exposed to a disease organism that triggers the immune system to produce antibodies. So putting it into simple words, it can be a natural infection or it can be a vaccine. So natural infection, like you come in contact with an infection, so your body will produce a defense mechanism and this develops an immunity to it naturally. And this is known as natural immunity. Again, vaccine also produces a natural immunity, which means when you inject a vaccine, again, we are provoking an immune mechanism in the body that protects the body against certain infection causing agents. Now, second one is artificial immunity. The name suggests again, immunity that develops by the transfer of artificially made antibodies. These antibodies can be maternal antibodies, like when you are in your mother's womb, the maternal antibodies or the antibodies developed by the mother gets transferred onto you, and that is known as a maternal antibody, which gives you protection against certain infections. Or it can be passive, like artificial antibodies, also known as immunoglobulins, that you receive externally. So we have spoken about what is immunity, how immunity is mediated in our body, what are the different types of immunity. Now, there's a condition when your immune system goes weak. So what happens when you have a weakened immune system? You'll get recurrent infections, recurrent cold, cough, fever, running nose, throat pain. You'll have pneumonia. Even with a mild infection, you can go in for a pneumonia with high rate of complications, hospitalization, even causing serious complications like respiratory failure, respiratory arrest, or even a terminal event like death. Or sometimes there may be skin lesions. When your immune system goes weak, you may develop skin lesions. Fourth one, due to weakened immune system, you will have autoimmune diseases, which means your body will produce antibodies against your own tissues where you may develop autoimmune conditions like commonly arthritis, which involves joints. So what can cause weakened immune system, or what are the factors which cause a weakened immune system? Number one factor, chronic stress. Chronic stress due to personal reasons or due to your lifestyle or due to your job site stress factors, all these things can lead on to a weakened immune system. Second one, poor diet. Poor diet, a lot of junk foods, sugary items, high carbohydrates, high trans fats in the diet, all these things can contribute to a weakened immune system. Third one, physical inactivity. Sedentary lifestyle, lack of physical activity, lack of proper exercises, all these can lead to a rapid weight gain, obesity. This can again affect your immune system. Fourth one, vitamin deficiencies. Very common, especially in elder population. You may have vitamin D deficiency, B deficiencies, especially B12 deficiency. All these things may cause weakened immune system. Especially if somebody who is not a vegetarian can go in for a vitamin B12 deficiency. Elderly population, sometimes due to their ill health or due to their lifestyle or due to their changes or a shift from their hometown to the a metro city like Bangalore, you will not be often going out, again causing inadequate sunlight exposure, vitamin D deficiency, all these things weaken your immune system. Fifth point is personal hygiene. A poor personal hygiene, again, is a very big risk factor which may affect your immune system. Disturbed sleep, improper sleep, early awakening, not a sound sleep, difficulty falling asleep, all these factors may cause a weakened immune system. Poor gut health. indigestion, recurrent loose motions, some kind of dyspepsia, poor tolerability to spicy foods, and basically a poor gut health can again cause a weakened immune system. Then substance use, smoking, alcohol, other types of substance, say anything that can, tobacco chewing, all these things may again cause a weakened immune system. Now, we have spoken what is the cause of weakened immune system. Now, the answer comes from there. How to boost your immune system? Get enough sleep, practice meditation, eat plenty of fruits and vegetables, take timely vaccines, personal hygiene improvement through washing your hands, exercise daily, take your vitamins, avoid substance use like avoid alcohol and cigarettes, wash fruits and vegetables properly, hydration, that is very important. Last but not the least, hydration, drink enough water. Now, let me just show you a quick video. This is based on the WHO message on vaccination. Yes. So what vaccine is required for all. That is the WHO message. Now, see, when we talk about vaccine, we are commonly talking about vaccination for kids. All of us are aware. We go bring our kids or your grandchildren to a pediatrician or to a hospital for vaccination. So almost always when we think about vaccination, we think it's mostly for children or for the pediatric age group. Now, there is also something called as adult vaccination. This concept is very much popular in Western countries or in advanced world where adult vaccination is as important as pediatric vaccination. But this is gaining popularity in India also. So why adult vaccination is important? Most of you will be thinking, being an adult, why do I need vaccination at this age? So see, adult vaccination is important because the effect of childhood vaccines wean off as we age. As we grow older, our bodies become more susceptible or vulnerable to disease. So most of us might have received some or most of the vaccines as a child. But these vaccines wean away, start their effects, start weaning away after a certain point of time. And with aging, our lifestyle changes, change in our general health, our immune system keeps on deteriorating. So this is the stage at which we may again require vaccination. Vaccines help prevent numerous diseases, including some that are potentially deadly. There may be certain infections which are quickly life-threatening. So vaccines will help us to prevent getting those infections. So it is not only for your protection. The whole concept of vaccine is not only personal protection, but there is something known as herd immunity. When more people are vaccinated, it creates herd immunity. Means when you are vaccinated, a lot of you will be having this effect of vaccine and you will be excreting the antibodies in your body fluids, and this will create something known as herd immunity, which will protect not just you but your family as well as your society, so that the chance for a disease to spread reduces. This is why we do mass polio vaccination every year for young children. This gives not only protection for you but also for the entire society. So whether you are looking to protect yourself or others, getting vaccinated is an important step in health management. Now, adult vaccine recommendations. See, as children, we have often seen there's a schedule for pediatric vaccines. Just like that, there are few vaccines that are required for adults as well. So there is something called as DPT, which is a triple vaccine that protects against D for diphtheria, P for pertussis, and T for tetanus. So this is one essential vaccine that is required by adults, just like the pediatric age group. Influenza vaccine, pneumococcal vaccine, herpes zoster or shingles vaccine, which you all might be familiar, HPV or human papilloma virus vaccine, which is a new vaccine in India for females. And there are certain vaccines which are reserved, which are not mandatory, but has to be taken by high-risk individuals. When we talk about high-risk individuals, it means patients who are sick or at a risk of developing infections, like those having chronic liver disease, or those who are receiving steroids for a long term, those who have had multiple comorbidities, or people who are on some kind of treatment for cancers or some chronic conditions, or patients who have some kind of immunocompromised stage or weakened immunity. So there are certain vaccines which are mandatorily to be taken. Those who are undergoing dialysis, there are certain vaccines are to be taken by, especially by them. So the recommended adult immunization schedule. So as I mentioned about the few vaccines, so the first one is influenza vaccine. So this protects you against common viral infection or common flu, what we get every year. I'm sure all of us get at least 2 to 3 episodes of flu in a year, the common fever, cold, cough, those kind of things. So influenza vaccine can be taken by anyone who is more than 2 years of age, including pregnant ladies can get an influenza vaccine. This has to be ideally taken once in a year. Sometime around August to September is the ideal time of getting an influenza shot. So even if you get an influenza shot, it will not prevent a common cold or a flu, but it will reduce the number of episodes of infection that you will get, and it will also reduce the severity of the infection that you will contract. So influenza vaccine is recommended for anyone over the age of 2 years, especially elder population over the age of 50, because they are at an increased risk of developing multiple episodes of influenza with more complications and more severity. Next one is the MMR vaccine. This is a very common vaccine that we give for children. In children, it is given as a 2 shot, but in adults, this is given as a single dose. This prevents against 3 infections: mumps, measles, and rubella. So anyone can take this except for pregnant ladies. So it is also indicated for adults. Third one is the chickenpox vaccine. You will be all common about or aware about the condition called chickenpox or varicella. This actually consists of 2 doses of vaccine at least 4 weeks apart, but it is not recommended for adults over 50 years of age. This is because after 50 years of age, there may be an exaggerated response to the vaccine. So it is not usually recommended for adults more than 50 years. For less than 50 years, it can be beneficial. So chickenpox vaccine, 90% it will prevent you from the infection. If at all you get the infection, it will be very mild. Now, the fourth one is the shingles vaccine. This is a very important vaccine for adult population. It is recommended for all adults more than 50 years. You might have seen the ad featuring Amitabh Bachchan where he speaks about the shingles vaccine. So it is a 2-dose vaccine wherein you get the first dose and the second dose anytime after 2 months. This prevents a condition called as shingles. Shingles is nothing but it is a chickenpox-like infection that affects one half of the body in any part which is supplied by a single nerve, where you will have a lot of pain and chickenpox-like rashes. So shingles vaccine can prevent the shingles itself, or if at all you get a shingles infection, it will reduce the pain associated with the infection. So this is recommended for all adults in India after the age of 50. Now, the next vaccine is typhoid. Typhoid also
Hello,
can...
sorry to interrupt you. At what frequency should these be taken? You're not mentioning that.
Yes, shingles is a 2-dose vaccine. One vaccine, if you take now, the second dose is at 2 months. Anytime after 2 months can be taken, but before 6 months, the second dose should be completed. I hope I'm clear. Is there anything that requires further explanation?
My question is how frequently, I mean, is to be taken every year, every 3 years, 5 years, 10 years?
No, no. Shingles, see, that I'll come. Any vaccine which I have mentioned 2 doses or 1 dose, that is sufficient. Influenza is yearly once. I have mentioned that once, that it is annual once. MMR is lifetime once. Chickenpox is also 2 doses, lifetime once. Shingles is lifetime once.
So
So
MMR, if I've taken MMR as a child, do I need to take it?
after the age of 50, you can still take 1 dose.
Okay.
Yes. So can I resume?
Yeah, yes, please. Just mention
Yes.
all these so that it becomes the frequency is also, I mean, every 5 years, 1 year.
Yeah. For coming ahead for the other vaccines where the boosters, I think I'll be coming up with that. So typhoid, it is a single dose. See, again, typhoid is not a mandatory vaccine. It is usually recommended. It is not that you need not take vaccine, but it becomes more significant when somebody in your household gets a typhoid or you understand that there's an outbreak of typhoid in your area, or you are traveling to an area where the risk of contracting typhoid is more, then you can definitely go for a typhoid vaccine. In Bangalore, I would suggest it is better to take a typhoid vaccine because we all depend on outside food and maids to consume our, the people who cook the food for us, we are not sure about their health status. So it is always better to go for the typhoid vaccine. It is a single dose vaccine, but you will require booster after every 3 years. And the another one is the Tdap. Tdap is what we were talking. It is the similar to the DTP vaccine, DPT vaccine, which that we are giving for pediatric. For adults, it is known as Tdap. You will need 1 dose. It is even recommended for pregnant ladies. In anybody, including pregnant lady, can take a Tdap, and every 10 years you will have to get a booster dose. This is same as the tetanus toxoid. This vaccine is somewhat similar to tetanus toxoid, but the difference is that Tdap contains extra ingredients in the vaccine compared to a plain tetanus toxoid. So commonly we will say that every year you need a tetanus shot or you need 6 months, once in 6 months. It's not that actually. It is once in 10 years. So the next vaccine is a pneumonia vaccine. This is also a very, very, very important vaccine for elderly population. It is usually recommended as per the Indian government guidelines. It is usually recommended for elders who are over the age of 65. But we can also give it for people before the age of 65, in younger people also who have cochlear implants or who have had meningitis, or in people who have had some lung issues, or in case of patients who are undergoing dialysis on cancer treatment. Those before the age of 65 can also get. It is also a single dose vaccine, but you will have to get a booster once in every 5 years. See, pneumonia, there are actually 2-3 kinds of vaccine. The common vaccine that we give for routinely for people above the age of 65 is known as a pneumovac 23 vaccine. That is the common vaccine that we give for people who are above 65 years without any complication. But there is also another vaccine known as Prevnar, which is a different kind of pneumonia vaccine, which is given for people having added risk factors, like those who have a previous pneumonia, or those who are undergoing dialysis, those who have some other lung conditions. So for them, we can give 2 types of vaccines. One is a Prevnar, and then after 1 year, if you give the pneumovac 23, they'll have some extra protection, but it is not recommended for all the elders over 65. So this pneumonia vaccine is, though we say it is a pneumonia vaccine, it not only protects you from pneumonia, it also protects you from meningitis. So this vaccine is very important, because if you see, most of the people over the age of 65 will be hospitalized commonly with a pneumonia, and a hospitalization with pneumonia will usually worsen your general health. You become really sick, your background diabetes or hypertension or heart diseases, all those things go slightly here, there, and the general quality of health deteriorates, hospitalization, emotional burden, financial burden. So all these things can be prevented with a single shot of vaccine. So for anybody over the age of 65, we strongly recommend a pneumonia vaccine or a pneumovac 23 vaccine. Now the next one is the hepatitis B vaccine. So ideally, this vaccine is also can be taken by anybody, but it is more commonly recommended for those who have chronic liver conditions. Again, those who are undergoing treatment for like dialysis, cancer patients, etc., etc. So it is basically a 3-dose vaccine. Then meningococcal vaccine. Meningococcal vaccine is also can be taken by anyone, but we routinely don't recommend meningococcal vaccine. It is a single dose vaccine. Usually it is administered for those who are attending Hajj, as notified by the Kingdom of Saudi Arabia, or those who are traveling to certain endemic area where meningococcal infection, which can cause meningitis, is very common, or for immunocompromised people. But it is not a routinely recommended vaccine. Now, coming to the cervical cancer vaccine. This vaccine is also newly introduced in India, but it is nowadays everybody is getting aware about the vaccine. Cervical cancer is the second leading cause of death in young females in India. So this is the importance of this vaccine. It prevents cervical cancer. How cervical cancer commonly occurs is due to human papilloma viral infection. So this vaccine protects against the HPV infection, and thereby it prevents cervical cancer. So usually there are two types of vaccines that are available. One is known as Gardasil 4 and one is known as Gardasil 9. Now, the main difference between these two vaccines is Gardasil 4, as the name suggests, contains 4 strains of virus, which can give you around 65 to 70% protection against cervical cancer. Whereas Gardasil 9 contains 9 common strains of viruses, which can protect you up to 97% from cervical cancer, anal cancers, mouth cancers, as well as genital warts. Now, another difference between these two vaccines is the cost, of course. Gardasil 4 is a cheaper vaccine. Gardasil 9 is slightly expensive. But Gardasil 9 is the perfect vaccine, and usually it is given as a 2-dose schedule for children between the age of 9 to 14 and as a 3-dose schedule between the age of 15 to 26. Ideally, it has to be given for both males and females, but in India right now, we are immunizing only females. Now, there's a question. What if you are over the age of 26? Over the age of 26 up to the age of 45 also, you can get this vaccination, provided you have a discussion with your gynecologist. After the beyond the age of 45, there's no significance for the vaccine. Now, the hepatitis A vaccine. This protects you against hepatitis A infection, or the common jaundice causing viral infection that is usually spread through food and water. So this also contains 2 doses, and it is also not a mandatory vaccine, but again, travel or any outbreak in the community, then you can get the hepatitis A vaccine. And the last one is the rabies vaccine. Now, this is a very common vaccine. Now, anybody who has a dog bite or scratch, cat bite or scratch, monkey attacks, they can get a rabies vaccine. This can be taken by anybody irrespective of the age group. And in India, currently, it is given as a schedule of 5 doses on days 0, 3, 7, 14, and 28. Now, the advantage of the rabies vaccine is rabies vaccine protects you from rabies. As you know, rabies is not curable. So it protects you from rabies. Again, like if you take a vaccine and then you are protected for lifetime. Lifetime as in like anytime later you have a very severe bite also, this vaccine will give you some protection. So there is another type of injection that we give for those having a more severe or a grave wound after a bite or scratch, known as the immunoglobulin. Now, that administering the injection is quite costly, as well as it carries its own risk. So somebody who has taken a full course of rabies vaccine in the past will not require an immunoglobulin in case of a more severe bite or scratch. Now, I spoke about a lot of vaccines, but about the elderly people, as I mentioned, I would again like to highlight 2-3 vaccines. One is the shingles. Now, what is shingles vaccine? I'll just put a quick reminder. It is a vaccine that protects against shingles. Shingles is a painful skin rash caused by reactivation of the chickenpox virus. So anybody who has had a chickenpox during their childhood or any point of their life, the virus stays inside our body forever, and this provides immunity for the infection. I mean, you don't get a second attack of chickenpox because you already has this virus within you, which is giving you the immunity. But when your immune system gets weakened, say due to old age, diabetes, any condition where your immunity goes weakened, this virus may get reactivated in the body and it will travel along a particular nerve, causing painful skin rashes along one area of the body. This is known as shingles. So this vaccine protects you against shingles. It is highly recommended for adults above 50. It will prevent shingles outbreaks and long-term pain associated with shingles. The shingles not only affect some part of your body like your chest or your legs or your arm, it may also affect your ears, causing hearing loss. It may affect your eyes, causing vision loss. So it can reduce the complications associated with shingles in addition to the pain. Now, just 2 doses, 1 dose now and 1 dose after 2 months. This is the course for shingles vaccine, and it gives you long-lasting protection, and it helps you to maintain quality of life by preventing severe discomfort. Now, the next vaccine, as I told you, is the pneumonia vaccine. This will protect you against lung, brain, and blood infection caused by pneumococcal bacteria. This is strongly recommended for anybody over the age of 65. But as I mentioned before, people who are younger than 65 with certain conditions are also eligible to remove the pneumococcal vaccine. Again, typhoid vaccine. This prevents typhoid fever, which is usually caused by contaminated food and water. This can be also taken by anybody belonging to the younger age group also, but it is highly recommended for those having over the age of 50, especially with diabetes or who have heart issues or who are traveling. Why? Because it prevents severe infections, it lowers hospitalization risk, travel protection, and it strengthens immunity with age. And as I mentioned before, say Bangalore, we food handlers are usually maids who come to our home, or we go out and have food cooked by restaurant food handlers. So we are unaware of their health status. So it is highly recommended to take a typhoid vaccine. It is a single shot vaccine where you will require additional boosters after every 3 years for long lasting immunity.
Yeah, ma'am, excuse me, I have a question. Now,
Yes.
I'm 60. So at 60, if I take one single dose of typhoid, will it be enough for the rest of my life, or do I have to take it every year or so?
No, it is after once in every 3 years. Now you take it at 60. After 3 years, you will need another booster. One vaccine can give you good immunity only up to 3 years.
Okay, thank you, ma'am.
Okay. There are certain frequently asked questions. Do vaccines have side effects? See, as such, vaccines do not carry a side effect in 95% of the cases. There may be cases where somebody may be allergic to one or more constituents of the vaccines, wherein, those vaccines or further doses of those vaccines or any vaccines containing any of the ingredients may be contraindicated. But otherwise, vaccines do not carry any major side effects. Like influenza vaccine, you may get mild fever, body aches, influenza like mild symptoms lasting for 3 to 4 days maximum, or you may have local pain at the injection site and local rashes. But other than that, most of these vaccines do not carry any serious side effects. Now, second question is, are vaccines safe to take? Always consult a doctor before you want to take a vaccine. They'll assess your health status and will recommend whether you are eligible or this vaccine is safe to be administered. Anybody over the age of 50 years, it is better to consult the doctor, but overall the vaccines are safe, even though in certain conditions, the vaccines may be contraindicated. Like certain vaccines, we don't recommend MMR vaccine, we cannot give for a pregnant lady. Chickenpox vaccine, we cannot give to somebody over the age of 50 years or somebody who has a weakened immune system. So there are certain cases where some vaccines may not be safe, but overall, most of the vaccines are safe to take. Now, the third question is natural infection better than vaccination? Now, most of you will be wondering, like, why do I need a vaccination? Let me have the infection so that especially in case of chickenpox, we'll be thinking, okay, let me have the chickenpox and then I become lifelong immune to the chickenpox. Why do I go for a vaccination? So always a natural infection, especially when it happens in an elderly age group or in an advanced age group, the severity and the course of the infection will be longer. Imagine one of your grandchild getting a chickenpox infection when he or she is 3 years old. They'll just have a mild fever, body pain. They'll have rashes that will heal in 5 to 7 days maximum. But at the same time, when you get it after the age of 40 or 50 or 60, then the infection may go on for 7 to 10 days. There will be more profuse rashes. There is a very high chance of developing complications like pneumonia, intestinal infections, meningitis, lot of issues which may require hospitalization. So always a vaccine will it will lighten the course of the natural infection. It will make the infection less severe. It will reduce the course of the infection, and most of the time it will protect you from the infection. So always getting a vaccination will help you from getting a severe infection. Now, will I get the disease after taking the vaccine? Certain vaccines, see, especially with influenza, see, virus is a very smart organism. Once you take an influenza vaccine, it doesn't mean that you are protected from getting a flu. You will get the flu because the virus is very notorious to change its appearance or its nature with every season, so that there will be one kind of viral infection. Next time you get the next infection, it will be a different kind of infection. But how influenza vaccine protects you is, it will reduce the number of episodes and it will lighten the picture. That is why we advise to take influenza vaccine annually once. What we do is, every year the government will manufacture a new kind of vaccine, which includes strains which were more commonly seen during the previous year, so that it will protect you in the year ahead. So even if you get the vaccine, you will get a very milder infection and at a very lesser frequency. Now, are vaccines safe for pregnant women? This is also a very common question. So in general, most of the vaccines are safe for pregnant women, but live attenuated, there's a category of vaccine. There are different types of vaccines, especially there are two types of vaccines, live vaccines and attenuated vaccines. So live vaccines are contraindicated in pregnancy because there is always a chance for the vaccine, the constituents in the vaccine to cross through the placenta and affect the fetus, causing some issues in the baby. So such live vaccines are usually contraindicated in pregnant ladies, especially MMR vaccine is contraindicated in pregnant ladies. Chickenpox vaccine is contraindicated in pregnant ladies, but at the same time, certain vaccines are safe in pregnant ladies, like influenza vaccine. There are certain vaccines like Tdap, which is indicated in pregnancy to prevent infection. So the take-home message is always choose a vaccine, but before getting the vaccination, please consult your doctor so that they'll suggest you the right vaccine and the right time to take it. But vaccine will always improve the quality of your life.
Thank you so much, Dr. Jyoti, for that insightful and informative session. On behalf of Vayah Vikas and Bridge Health, we would like to extend our deepest appreciation to everyone who joined us today. We hope this session has helped deepen your understanding of how immunity and vaccination play a vital role in healthy aging. As always, our goal is to provide meaningful knowledge that empowers older adults and their caregivers to make informed health decisions. If you have any feedback or suggestions for future topics, we would love to hear from you. Stay well, stay safe, and thank you once again for being part of this informative session. Thank you.
Thank you.
Thank you.